Hello everyone, welcome to the CPT Guidelines tutorial series. In this video series, we will be looking at simplified CPT coding guidelines with examples, mock questions with answers. This series is designed to help you easily understand the CPT coding guidelines with real world examples. So please follow my channel and check out my other playlist as well. In this video series, the first topic we are going to see is Evaluation and Management Coding Guideline. Evaluation and Management Services Guidelines. Codes that describe physician and qualified healthcare professional services to evaluate and manage patient health. Purpose of these EM codes are standardized reporting of encounters between patient and providers, capture the complexity, intensity, and time of medical services, used for billing and reimbursement. So when you take the categories of EM services, the EM services are broadly categorized based on the setting, type of service, and the patient status. So there are so many categories available. For example, office or outpatient services that can be divided into new patient and established. Then the hospital observation services. Now the hospital observation services are included in the inpatient hospital care. Now the topic goes as hospital observation services and inpatient hospital care. Then the emergency department services, consultations, office or hospital, critical care services, nursing facility services, home and resident services, preventive medicine services. So each have its own code range and unique guidelines. So we will see each one by one with the real world examples. In 2025, telemedicine services, synchronous audio video evaluation and management services, synchronous audio only evaluation management services, brief synchronous communication technology services also added. We will see these guidelines with the real world example as well. Before that, you have to know what is new and established patient. So in simple form, the new patient is he has not received any professional service from the provider or group practice in past 3 years. Established patient is has received services in the last 3 years. Okay, decision tree for new and established patients. This table is available in your CPT codebook. So here it is in detail explaining how to divide the patient as new and established. So received any professional service from the physician or other qualified healthcare professional or another physician or other healthcare professional in same group of same specialty within past 3 years. If no, he is new patient. If yes, then we have to check whether this is the exact same specialty. If it is no, that patient is new. If it is yes, then we have to check whether the exact same subspecialty. If it is no, it is new patient. So the specialty, this is subspecialty. If it is not the same subspecialty, he considered as a new patient. If it is the same subspecialty, it considered as the established patient. This is how patients are divided as new and established patients. So the key components of evaluation and management code selection. So before 2021, traditionally three components were used. That is history, examination, and medical decision making or time. So time is when counseling or coordination dominates more than 50%. But after 2021, the major change occurs in the CPT guideline and the EM guidelines updated as significant changes of office and outpatient EM evaluation and management codes. The code selection is now based on level of medical decision making, that is MDM, or total time spent in the date of encounter. So the history and exam are still required but no longer scored for level of selection. So when you consider the elements of medical decision making, the MDM is determined by 1. Number and complexity of problems addressed, 2. Amount and or complexity of data reviewed and analyzed, 3. Risk of complications and or morbidity or mortality. So MDM levels there are 4 levels: straightforward, low, moderate, high. Each level requires meeting or exceeding 2 of 3 MDM elements. Since 2024, the CPT codebook included these following elements of medical decision making table. So here you can see straightforward, low, moderate, and complex. So you have to be thorough how to categorize each category. For example, if you take straightforward, the complexity is minimal, that is self-limited or minor problem. Amount of complexity of data to be reviewed is minimal or none. The risk of complication is minimal risky, that is straightforward. Low is the number of complexity is low, that is 2 or more self-limited minor problem or one stable chronic illness, or one acute or uncomplicated illness or injury, or one stable acute illness. Amount of complexity is limited. For example, category 1 test and documents any combination of two from the following. So you have to read these things and you have to be thorough with this. And the risk of complication, low risk of morbidity from additional diagnostic testing or treatment. The MDM, if it is moderate, the following criteria should be there. The moderate is so one or more chronic illnesses with exacerbation, progression, or side effects of treatment, or two or more stable chronic illnesses, or one undiagnosed new problem with uncertain prognosis, or one acute illness with systemic symptoms, or one acute complicated injury. So when you take the amount of complexity of data to be reviewed is moderate. So here category 1 test documents or independent historian any combination of three from the following. So you have to read this one. And or category 2 independent interpretation of tests, and category 3 discussion of management or test interpretation. So you have to be no need to memorize this thing, but you have to understand what it is. And also the third is moderate risk of morbidity from additional diagnostic testing or treatment. Example, prescription drug management, decision regarding minor surgery with identified patient or procedure risk factors, decision regarding elective major surgery without identified patient, procedure, or diagnosis or treatment significantly limited by the social determinants of health. The MDM level is high on the following conditions. The number of complexity of problem addressed at the encounter is higher. For example, one or more chronic illnesses with severe exacerbation, progression, or side effects of treatment, or one acute or chronic illness or injury that poses a threat to life or bodily function. So the amount of complexity of data to be reviewed and analyzed extensive. So must meet the requirements of at least 2 out of 3 categories. So you have to read these things. And the risk of complication, high risk of morbidity from additional diagnostic testing or treatment. For example, drug therapy requiring intensive monitoring for toxicity, decision regarding elective major surgery with identified patient or procedure risk factors, decision regarding emergency major surgery, decision regarding hospitalization or escalation of hospital level care, decision not to resuscitate or to de-escalate care because of poor prognosis, decision regarding parenteral controlled substances. So those categories are included in the MDL level high. Let's check an example scenario. So the nature of presenting problem. The severity of the problem affects the ENM level. For example, minimal is like BP checkup. Self-limited or minor is cold. Low severity is example uncomplicated sprain. Moderate severity example multiple chronic conditions. High severity example life-threatening illnesses. Let's look at evaluation and management services categories one by one with the examples. So below is an overview of the primary categories as defined in the CPT professional guidelines. So the first one is office or other outpatient services. So they are among the most frequently reported EM services, covering visits in a physician's office, clinic, or other outpatient settings. So here, as I explained earlier, new patient and established patient are there. The new patient is for patients who have not received any professional services from the physician or the qualified healthcare professional or another physician or the qualified healthcare professional of the same specialty and subspecialty in the same group practice within past 3 years. And the established patient is for patients who have received professional services from the physician or the qualified healthcare professional or another physician or QHP of the exact same specialty and subspecialty in the same group practice within the past 3 years. So let's see some examples. Patient returns to the physician office for a follow-up on hypertension and diabetes. Provider reviews labs, adjusts medications, and documents a moderate level of MDM. What is the correct EM code? There are 4 codes available: 99,212, 13, 14, and 15. So take your CPT code book and find the answer. So in this case, you can find the answer by several methods. So very easy, straightforward method is, first you have to highlight the question. So here the patient returns means it's an established patient and the level of MDM is a moderate level. So when you go to the evaluation management guidelines of the CPT code book, before the guideline, you will get the evaluation and management tables. So in the tables, it is categorized by office or other outpatient services, nursing care, home care. So there are several tables available. So in this case, patient come for the office visit. So office visit tables you have to So you have to go to the office visit table. They are new and established patients are there. So here in this patient is established patient, that is patient returns. So in the established patient, you have to look at the moderate level of MDM. So go down the moderate. So it marked as 99,214. So the correct answer is C. So this is the one method to find answer very quickly, but this is not a recommended way of finding answer because you have to directly go to the code and read the code description. So the second method is go to the CPT code book and go to the evaluation and management services guidelines section. You may bookmark with the tabs. In that section, the first part is the guideline, and the second part you can see evaluation and management. In this part, you can see first heading is office or other outpatient services. There you can see new patient, then established patient. So you have to go to the established patient section. So I'm going to the established patient section. Here you can see the patient, the codes are categorized as follows. So 99 to 11 is office or other outpatient visit. Established patient that may not require the presence of physician or other qualified healthcare professional. 212 is office or outpatient visit, evaluation of management of established patient, medically appropriate history and examination, straightforward medical decision making. But our one is moderate. So 913 is, you can see, lower level of medical decision making. 919 or 214 is moderate level of medical decision making. You can read the code fully. Office or other outpatient visit for the evaluation of management of established patient which requires a medically appropriate history and examination and moderate level of medical decision making. When using the total time of data, total time on the date of encounter for code selection, 30 minutes must be met or exceeded. So without mentioning the level of medical decision making, some questions will give you the time spent. So with the time spent, you have to calculate the answer. So this is the second method to find the answer. Third method is you can use the index of CPT codebook. There you can go to the first you have to go to the index of office or other outpatient visit. Then come back to the main page. You have to find the answer. So I'll show you that way also. When you go to the CPT index, the alphabetic O, there you will find office, NO, other outpatient services. There you can go to the subcategory of established patient. It direct you to the 99,211 to 215. Again, you have to go back the tabular list and confirm the answer. But this is time consuming. So very easy method is you using the table, and the second easy method is going to the section. Section you can read the contents, and then you can directly go to the codes. This is the third method. So you can use the preferred method you like. Question number 2. A 32-year-old new patient present for evaluation of migraines. The provider performs a medically appropriate history and examination and orders an MRI and develops a treatment plan. The provider spends a total of 50 minutes on the encounter. What is the correct EM code? So there are 4 answers: 99,203, 4, 5, and 14. So take your CPT code book and find the answer. Okay, in this case, you have to highlight this is a new patient. So total time of 50 minutes is spent in this encounter. Here, the level of MDM is not mentioned, but the time is mentioned here. So you have to find the code depend on the time. So new patient, time spent. So again, go back to your CPT code book, go to the evaluation and management section, table of contents. Here, go down and go to the evaluation and management, office or outpatient services. This is the new patient. So go to the new patient section. So here you can see 202 office or other outpatient visit for the evaluation and management of a new patient which requires medically appropriate history or examination and straightforward medical decision making. And you have to read continually when using total time on the date of encounter for selection 15 minutes. So here time spent is 15 minutes, but in our case that is 50 minutes. So you can read other codes. The similar codes are there. There are 203 is 30 minutes and 204 is 45 minutes must be met or exceeded. 205 is 60 minutes must be met or exceeded. But in our case, time spent is 50 minutes, 50. So that is included in this code, 45 minutes and must be exceeded. So the correct code is 99,204. So when you go back, you can see the new patient, total time spent is 50 minutes. So the correct code is 99,204. So this is the end of this part 1. So this is the first category we have seen, that is office or other outpatient visits. So in the part 2, we'll see other categories of evaluation and management services with the real world examples. So please subscribe my channel and check my other playlist contents as well. Thank you.